Hello, in this video, as you can see, we've navigated within Care Pathways into the Care of the Dying Adult digital pathway. And as you can see, it is in the form of a workflow that we're used to using every day. So the first component is the initial medical assessment. Then we have the Care of the Dying Adult documentation. Now this will show details of things like respect plans or any previous input from the palliative care team, for example. Show the patient's medications and the medications component, and it will show certain forms that are pertinent to the Care of the Dying Adult digital pathway, such as respect within the forms component there. So we're going to start with the initial medical assessment. Now these are a series of questions where you'll see the questions on the left-hand side, and any outstanding tasks or guidance you will show on the right-hand side. So the first question is if I'm a doctor or not, and again you have to be a doctor to fill in this care pathway. Now if you were to click I am not a doctor, it will tell you to stop and give you guidance on what to do next. Now if you clicked any of these questions by accident, all you need to do is click into the box again to remove the answer, and then you can then go forward and put the correct answer in. So I'm going to click on I am a doctor. The first question is, has the MDT agreed that the patient is felt to be imminently dying or has the potential to die within hours or days? Again, if you clicked on no, it will tell you that this care pathway is not recommended, but I will click on yes to continue. And have the reversible causes been excluded or treatment declined? Again, clicking on no will ask you to exclude the reversible causes first before proceeding. But I'll click on yes. And it will go to continue the assessment part 1. Now to continue, you have to just select the box to open the next question. Does the patient have capacity to understand their situation and be involved in discussions about their care? And it gives you a bit of reference that if you want some guidance on this, you can visit this Safeguarding Adults workspace on SASHNet for help. Now there's different answers you can put in here. If you were to put no, it will tell you to follow the mental capacity guidelines. If you click on uncertain, it will open a question and it will give you a chance to fill in the mental capacity assessment form by clicking on the blue link within the question. However, I am going to undo the uncertain and click on yes. The next question is, has the patient and or family or lasting power of attorney been informed that the patient is thought to be dying? And again, if you click on no, it will ask you to inform the family of the prognosis at the next available opportunity. And you can provide details in there of what you've done. The next question, has a referral to palliative care been made? Now, if you were to click on no, that's fine, it won't refer, but if you click on yes within this, it will automatically refer to palliative care for you, and you can click on save, and it will also ask the questions over as the patient consented, for example. But again, we're going to click on to assessment part 2 by clicking into the box, and this is, are the patient's symptoms well controlled at the current time? If you click on to no, it will ask you to look at giving maybe a stat dose of antiemetics or pain medication. But we're going to click on yes for the purpose of this video. And the next question, are subcutaneous medication available PRN in case of pain, breathlessness, nausea, agitation, chest secretions? Again, if you click on no, it will tell you to prescribe these medications, but we can click on yes. And then, have any non-essential drugs been discontinued? If you click on no, it will say to discontinue and to review the drug chart. And have non-essential observations and investigations been discontinued? And again, if you clicked on no, it will give you a prompt to review the current orders for this patient. The next question is if the patient has an ICD, has it been deactivated? Now, if you were to click on no, you can it tells you that you can find the guidelines on the palliative care workspace of how to do that. Or if the patient hasn't got one, you can click on non-applicable, which is what I'll do now. And again, continue to the assessment part 3 by clicking into the continue box. And is the patient able to drink currently? If you click on yes. And is the patient diabetic? And again, it gives you tells you to visit the Diabetes and Endocrinology workspace on SlashNet if you want any further advice or guidance on this. But I'm going to click on no for this patient. And have you explored organ tissue donation? And again, it gives you advice to go to the organ and tissue donation workspace if you need to go there. But I'm going to click on not appropriate at this time and then continue to assessment part 4. And does the patient have any spiritual or religious beliefs? You've got to say it tells you to go to the chaplaincy or spiritual care workspace. However, I'm going to put yes. And is the patient's preferred place of death known and where it's at? We don't know at the moment. Click on unknown, or you can put the information in the box before. And the last question is, I should confirm that the patient should be placed on the care of the dying adult digital care pathway. And you click to say confirm. And then once you've finished, you can click on save. Now you must click on save to make sure that your referrals go through and to save the documentation. So we're going to click on save now. And again, the next step would be to, if you needed to prescribe any end-of-life medication, you can do it in here, which we're going to show you in the next video. But to go through this workflow again, as I say, we've got the documentation, but then in Forms, you've got the links to the different workspaces in there. And then the Power Forms, you can also do the respect plan from here. But if you've put this patient accidentally on this pathway, you can a different video how to remove them.